You have to classify it first that patient have slow heartbeat or fast heartbeat. Like if the patient have arrhythmias, type of slow heartbeat, which is could be the upper and the lower chamber is not working together. We call the complete heart block, or their own pacemaker is not functioning well. The heart just beating and then it just stop beating and then you have pause. All these people may come with fatigue weakness or fainting spell. Normally treatment of all this bradyarrhythmia, if you cannot fix it, such as if the patient didn't take medications or they didn't have electrolyte abnormalities such as hyperkalemia or high potassium, if something that's not fixable, then they would end up with we call pacemaker, which is the artificial device that it's a small device that you implanted under the collarbones, and you put either 1 or 2 leads inside of the heart, and then the machine will kick in whenever your heart rate is slow, or when your heart rate is stopped, it will start kicking in and prevent you to have the slow heart rate. If you have some fast heartbeat, the treatment is also different. It can be from upper chamber or could be from lower chamber. If it's from the upper chamber, most of the time arrhythmia can be treated with medication most of the time, but electrophysiology study or radio frequency ablation that you mentioned is another option of treatment when the patient fail medication treatment, or the patient have side effect from medication treatment, or sometimes it can be just when it could be just the gold standard of treatment without medication sometimes. But if you have fast heartbeat from the upper chamber, some people born with some short circuit inside of the heart. Normally you have electricity connecting the upper and lower chamber with just one way. Some people born with 2 way. When the electricity come down, it can go up, cause the irregular heartbeats. So the electrophysiology is we put the small catheter to the groin. It's go inside of the blood vessel and go inside of the chamber of the heart. And when you bring the patient to the lab, we do the electrophysiology study. You try to stimulate the heart and try to bring out the irregular heartbeat that they have. Sometimes it's not occur by itself. We have to give medicine. And whenever we can bring up that irregular heartbeat, we use that small tip of the catheter. We can try to find where the abnormal electricity coming from. Sometimes, if it's more complex, we might have to use something called electroanatomical mapping system that we create the chamber of the heart and can look it into 3 dimensions. And it can tell us where the abnormal circuit or short circuit coming from, and at the tip of the catheter that you put it in, you can generate the heat and you burn that area that have abnormal circuit with the heat, and then make that area cause the injury to that area and cause that small area to become a scar, and then you can cut that abnormal circuit.